The following segment is presented by Bremo Pharmacy.
It's September, and that means it's time to start thinking about the flu. That's right, unfortunately, but the best way to keep yourself protected this season is to get vaccinated. Ann Anderson is here from Bremo Pharmacy, as always, to spend a little time with us, talking about the importance of the flu vaccine. Let's talk about the fact, something people may not know, is that more than 200,000 people a year are hospitalized because of the flu.
Yes, and over 36,000 die each year from the flu. And the best way to prevent the flu is to get vaccinated.
Yeah, so if you think the flu isn't a big deal, you are very, very wrong.
Yeah, it's not to be taken lightly.
No,
right.
It really isn't. People think we're just sick for a few days, it'll pass in 5 to 7 days, but there's some real complications that come from it.
Mm-hmm. Yes, there are some complications that come from it because the flu can lead to pneumonia, hospitalizations, and then, as I refer to, ultimately can lead to death in some people.
We don't want that, so let's get vaccinated.
Yeah.
Who should get vaccinated for the flu?
Bottom line, anybody who's over 6 months old should get vaccinated for the flu. In particular, those who are at high risk for those complications that we referred to, people who've got chronic diseases like diabetes, lung disease, asthma, those people should be vaccinated. The very young, under 5 years old, or the very old, over 65, those people should certainly be vaccinated because they're at higher risk for complications.
Now, are they higher risk because they're so young, they're not, their bodies can't fight it off, and then maybe on the other side because their bodies have been fighting things for so long? Is it just a diminished capacity of the body to fight these things?
It's important for those people to get immunized. If you're below 5 or over 65, we know that's where the complications occur.
That's where the biggest
That's
risk
why it's
is.
important, because we know that's where the biggest risk is. And also, anybody who lives with or takes care of those patients are people who should certainly be vaccinated as well. Pregnant women should also be vaccinated. That's the only way their infant is going to get antibodies, because the infants can't be immunized until they're 6 months old.
All right, so if a pregnant woman gets immunized, the baby then transfers to the baby as well.
It's the only way the baby can develop antibodies, yes.
That is amazing. All right, Bremo Pharmacy obviously can help with vaccinations. So tell us a little bit about that, how that's going to work when we go to Bremo.
It's very easy. You can go to Bremo on Staples Mill in the Crossroads Shopping Center, or Bremo Pharmacy in Henrico Doctors on Forest. You do not need an appointment. You do not need a prescription.
Okay.
6 months and older, you do not need a prescription. You'll sit down, talk to the pharmacist, and they'll decide, look at your risk factors, see if you are in that high-risk category or what your age is, to determine, is the vaccine the best option for you, or is the nasal the best option for you?
All right, now a lot of people think there's a common misconception that you can get the flu by getting the flu shot.
That is a very common misconception, and you cannot get the flu from the flu shot. It is not a live vaccine. You cannot get it from the flu shot.
You want to say that again? You cannot get the flu from the flu shot.
That's right.
All right, Ann, thanks for that great information. A reminder that you can go to Bremo Pharmacy for a free osteoporosis screening as well. So just go for all the information to bremorx.com.